name's Wyncel Chan. I am a new graduate in the field of pediatrics. I finished my residency in Flint, Michigan with Hurley Children's Hospital in 2020, and I'm starting to become a general pediatrician this fall with IU Health in Bedford, Indiana. I will be associated with Indiana University, Riley Children's Hospitals and Clinics, and Southern Indiana Physicians. I'm originally from Vancouver, Canada, and I am an IMG because I went to a Caribbean med school called Saba. It's a little tiny island, and I did 2 years there, followed by 2 years of rotating around the States for my clinical rotations before I matched in 2017 into pediatrics. The best part about being an IMG is the traveling. Although hard, it makes the experience definitely different than your conventional, traditional route of becoming a doctor. I would say that getting to see parts of the world and travel the United States has given me so much insight into a bigger picture, a more worldly view, and different cultures and kind of customs around the country. And I think that was an asset for sure, becoming a doctor. And I mean, becoming an IMG, although difficult, also teaches you resiliency, and that is something that money can't buy. As an IMG, I chose pediatrics because it is the first and only thing that I really wanted to become when I was going into medicine. I have always been drawn to pediatrics in terms of working with the families and the parents, and then getting to see a child from the newborn age up until adulthood. And I was also a pediatric patient when I was younger, and I just learned that it was super important to become a partner with the families and the patient, and I really wanted to become that for other people. My overall experience with residency was super positive. I ended up in Flint, Michigan, which I had not known anything about, but I was grouped together with a whole female class, 7 originally, and we graduated with 9, and it was just such a good experience. It was a very wholehearted family kind of feeling. There was limited competition, and it was all about helping each other out and leaning on each other. So I would say that it was definitely one of the best experiences that I could have asked for in residency. Being in a smaller program probably lent its hand into that kind of experience, and I don't think it was by any mistake that I matched there. My experience as an intern PGY resident was probably like many. It was daunting and scary, but you get yourself through it. It's a lot of question asking, a lot of reading, and a lot of remembering that you are worthy to be there. Imposter syndrome is so strong, especially as an intern, and throughout one's medical career, but especially when you're switching from that medical student role into becoming called a doctor and making some of those decisions, although you are backed up with an attending and your senior co-residents, it is definitely scary. And what I would recommend to all residents headed into their intern year or starting off their intern year this July that has just passed is to take it day by day, and just know that as long as you're doing your best and reading up on it afterwards, you don't have to know all the answers right away. No one expects that of you, and you shouldn't expect that of yourself. But you should definitely take it a moment to reflect on whatever you're learning or whatever patient you're seeing, and try and read and better yourself about it afterwards. But just know that you're not the only one that's dealing with those kind of second-guessing moments, and that you're not alone in that journey. Everyone's gone through it. Everyone knows how hard it is to be an intern, and you'll get through it. It does pass. But also to enjoy it and take time for yourself. It's easy to get lost in intern year as well as residency, and it's super important to take care of yourself before you can take care of anybody else. I think the ideal candidate for a person in pediatrics is somebody that is patient and approachable to not only children but to family members. You have to be able to communicate to a young child as well as reiterate the plan to family members. And it's very stressful for a family member, a parent, to hear that their child is sick. So you have to be a voice of reason and super approachable. But I think as long as your passion is to take care of a child and be there for them, you'll make an ideal candidate. I think, again, you have to be patient, caring, flexible is just a huge bonus for program directors. I think, again, that's a huge reason why IMGs are beneficial when they're being asked what you can bring to a residency program. It's really that you are flexible and willing to kind of go the extra mile to help a colleague or a patient along the way, and that you're easily adaptable to different situations, be it moving or a different rotation that's thrown at you or becoming the person that's on backup. All of these things are super important to a program, knowing that they can rely on you through difficult times. What I love most about being a pediatrician is the hugs and high fives, obviously, but it is the ability for me to be able to take care of a kid right when they're born, at that newborn age and the newborn visit, up until they're 21 and a young adult ready to move over into the adult world. I think that's a super cool thing to be able to do that not a lot of specialties get to experience. If you are a residency program director today, will you look at kind of those overall applications, or one thing in specific you look for? I think that program directors have a difficult task in terms of having to look at scores and look at the whole picture. If I was a program director, I would be looking at the interviewer and seeing how they answer and handle that day. Obviously, I would also be looking just at some of the things that they do for fun. I know that sounds kind of silly, but I think knowing that the person knows how to balance their life and experience things beyond the walls of the hospital or clinic would be an asset to a team. I chose Saba Med School because it was really one of the 4 big schools I was looking at in the Caribbean. It was one of the only schools, or still is one of the only schools, that is able to practice in all 50 states as well as Canada after finishing with the med school. Comparatively, although all Caribbean schools are expensive, I think Saba's was on the lower end of some of the Caribbean schools I was looking at, and I honestly didn't know too much about it before going in, so maybe a little bit of it was being a little bit naive, but I think the experience was, again, something that was just right for me. It's not for everybody. I think you have to understand that Saba is a small island. Before you go there, there is not a lot of amenities. There is no beach compared to some of the other Caribbean med schools, which are more resort towns, and they have a lot of grocery stores and hotels and kind of that island life that you might be drawn to going to a Caribbean med school. Saba does not have that experience, but that also means that there's less distractions, your class sizes are smaller, and I became super, super good friends with my classmates And again, that really helped me along the way in terms of rotations all around the states. You can lean on them and trust them for advice and places to live and those kind of recommendations. And in terms of the school itself and the education, they really do prepare you with the tools to succeed. You have to take all of their shelf exams and make sure that you're ready to take step 1, step 2, and to match into residency. And then they also do a research paper that they want you to have done before you move forward into year 3 and 4 of your med school journey. And I think that was really important because it helped me get published online through a peer-reviewed site, and that was something that really was talked about during my interview process. I just think the final things I want to say about being an IMG resident applicant is that you are such an asset. Don't let anybody ever tell you otherwise. It is daunting and scary to be on the lower part of the totem pole, so to speak, when it comes to residency applications. But again, you have so much to offer in terms of your resiliency and tenacity to continue forward with your dream despite all the odds. So I think as long as you remember that and you put yourself in that kind of light whenever you're talking to program directors and trying to match along the way, highlighting all those things that you thought were difficult and switching it into a positive is definitely something that other people just can't deny and other people cannot make up. So that experience that you have is a tool and an asset, and I would say utilize that as an IMG. You are more powerful than you think.